Hi, my name is Robert Shelley with Shelley Law, and my law firm assists physicians with employment contract and independent contractor issues. Today I'm going to talk about the average RVU compensation for a physician in family medicine. So, first, there are kind of three standard ways of compensating someone in family medicine or primary care. That would be just a straight base salary. So you just get a straight base and there's no productivity incentives or expectations. Two would be net collections. So essentially the physician would get a percentage of whatever the practice collected for their personally performed services. Or three, RVUs. Now, setting is important as well. So most physician-owned groups do not use RVUs as a measure of value, meaning that is not normally a way that the physicians are compensated. Most of the time, if you are being compensated via RVUs, you are either working for or in or with a hospital or healthcare network. Those are the ones that utilize RVUs the most. As more and more healthcare networks buy up physician-owned primary care groups, it's becoming, I'd say, more and more utilized throughout the industry. So more and more family med docs are being paid via RVUs because they're getting gobbled up by these big healthcare networks who are trying to expand their reach by bringing in all the primary care docs in the area. So I'd say this is much more used now than it was 10 years ago. So what is an RVU? It's a relative value unit. It's a measure of value used by the Center for Medicare Services, CMS, and they essentially award every encounter with a numerical value. And then what that value is determined by the length of time with the patient and the acuity of the visit. So how acute, what are you doing during the visit, and then how long are you with the patient? The higher acuity, the longer you're with the patient, the higher the RVUs that you generate. And so that's a number. Usually it's somewhere between like 1 and 10. And then that number gets multiplied by a compensation factor, so a monetary value. And that varies based upon specialty and geography are probably the two biggest factors in that. So the average RVU compensation for a family med doc is also determined by setting. So if you are in a physician-owned group, around $45 per RVU is the median. If you are working in a hospital, it's around 51. And then the average or the median RVUs generated per year for a family med doc would be around 5,000 if you're in a hospital, and around 4,800 if you're in a physician-owned group. Now, these are general averages. I'm not going to say what company or what data set I'm using. These are general averages. Obviously, it does change based on geography, based on the setting, how efficient the practice is, but those are just kind of general numbers. And so if you're paid purely on RVUs, you just multiply how many RVUs you generate and then times the compensation factor, and that's what you get paid. Most of the time, if you are getting paid in that way, when they bring you in, it will be under some kind of guaranteed base for a period of time, usually 1 or 2 years. So you'll get, let's just say you're going to make $200,000 for the first 2 years guaranteed. So it doesn't even matter what your production is. And then they will then shift from getting the guaranteed base to you're only paid via your RVUs. And usually they'll use the last 6 to 12 months or even do a rolling average of the RVUs generated to determine how much you're going to make moving forward. And so what they would do is they'll come up with a base number that's less than, so if you were making 200,000 on a minimum, or on the guarantee, then, and you were producing at that level, then maybe they'll pay you out at a 175 base, obviously annualized based upon pay periods. And then they'll do some kind of reconciliation, maybe monthly, quarterly. And so if you produced more RVUs or generated more money after doing the calculations than what they paid out, then they'll pay you a bonus, usually within 7 to 14 days of the end of whatever the reconciliation period is. And then they'll just continue on that process. What you need to be, concerned about is whether the organization that you're working with carries forward negative balances. So for instance, let's say, once again, they're paying you out at 175 as your draws, but you only bring in on an annualized level 150. Well, you're going to have a negative balance in that month or quarter or whatever it is. And so are they going to carry forward the negative balance, meaning you then need to make it up in the next quarter? Or at some point, if you continuously perform below, what they'll do is just move that draw number down until you bring it back up. So these are factors you need to think about. Another factor is your RVU production is not entirely on you, meaning the efficiency of the office plays a big factor in the efficiency of the doctor. So is the scheduling being done correctly? Are they rooming the patients efficiently? Is the H&P being done correctly? Like, what's the EMR that they use? Do you have a scribe? So like all of these factors can help in making a physician more efficient. And if there's a ton of turnover in the staff or they don't have appropriate staffing levels, this will affect your productivity and will ultimately result in you making less money as well. So anyway, that's a little brief introduction of kind of the average RVU compensation for a family medicine physician. Once again, these numbers can vary based upon geography, the setting of where you are, but kind of should give you some baseline numbers about what to think about. If you have any questions about an employment contract, independent contractor agreement, feel free to contact my law firm at the contact information listed below in the description. If you have any questions, feel free to leave them. I'm happy to answer any of them. Anyway, thank you for watching the video and take care.